Hello, my name is Dr. Ajay Oponi. I'm a consultant pediatrician and current head of department pediatrics, Muscat Private Hospital. I've been a consultant for over 11 years in the United Kingdom. I've got my CCT qualification in 2008. Before that, I'd done my MRCP not only in England, but also in Ireland, and my DCH. I have 22 years of pediatric experience in the United Kingdom. I did my basic training in India, and I was a gold medalist throughout my MBBS. It gives me great pleasure to introduce the pediatric department in Muscat Private Hospital. Muscat Private Hospital prides itself on being absolutely state-of-the-art, absolutely world-class, and has a very competent pediatric department, not only providing general pediatric care, but also has a neonatal unit, which at the moment caters for all deliveries above 34 weeks gestation. The unit is well equipped and well staffed with trained nurses, with doctors, consultant, and we pride ourselves on providing consultant delivered care. The consultants, such as myself, are UK trained, UK certified with a CCT, that Certificate of Completion of Training. The department has a number of subspecialties in pediatrics as well, inclusive of neurology, pediatric cardiology, gastroenterology, and we boast of having a very busy general pediatric OPD, which provides a variety of general pediatric facilities and care, including the immunization schedule as we follow the Ministry of Health guidelines, and all our pediatric practice is certified and is evidence-based, and the references are primarily the British system of pediatric care. We do follow NICE guidelines and NICE care. The department is also supported by very trained specialists, most of which have a primary and a secondary qualification in pediatrics. The nurses are extremely competent, some of whom are very advanced pediatric nurse practitioners, and this enables us to provide world-class care, and you can be rest assured that when your child comes to Muscat Private Hospital, it will be taken off as good as anywhere in the world. Thank you.
Hello, I'm Dr. Ayman Sha'rawi. I'm a senior consultant orthopedic surgery and head of orthopedic department in Muscat Private Hospital. I graduated from Cairo University, then I went for postgraduate to Geneva University, which was one of the best centers in Europe. I'm specialized in all types of fractures and trauma, and I do joint replacement, hips and knees. Our training and our hospital is doing the best way of getting the best result. We are using one of the best prostheses, which is the one will the patient keep when he will go out of the hospital, as exactly used in Europe and in America. Our technique of doing the surgery, which is making the joint which we are doing, is long lasting. When we talk about the success of joint replacement therapy, we talk about 20 years and above. It is not important to survive for 2-3 years. It is more important to the joint survive for many, many years, going up to 20 years. Our technique and our team in Muscat Private Hospital, they are able to produce the success in every patient. We take every patient as a friend. He is a sick guest. So when we treat the patient, we treat them with love, with care, and with understanding of their needs. Our long history of success is the one talking about us. In Muscat Private Hospital, we are one of the best center of excellency in the area, not only in Oman, because we are the benchmark of orthopedic department in Oman. We do a lot of trauma. Our success rate is going beyond 95%. our patients are walking around, you can ask your colleagues, your friends, your neighbor, definitely had some good experience with Muscat Private Hospital. So I believe that if you have a problem concerning your knees, your hips, or if, God forbid, you have a fracture, so I believe that you have to go directly to Muscat Private Hospital, where you will find the care, understanding you deserve. Thank you very much.
Hello, my name is Dr. Dimitri. I come from Serbia. There I graduated from the university. There I did my residency training. Then I did my PhD, and I completed most of my career in my native country, Serbia. I've been here in Oman for more than 12 years now. My specialty is internal and chest medicine. I would prefer saying chest medicine, which means it's not only cough. It's lots of other things, such as asthma, such as chronic obstructive pulmonary disease, and many infections and inflammations. So in Muscat Private Hospital, we can offer you quite a wide range of diagnostic procedures, including pulmonary function tests, as well as interventional diagnostic and treatment, which is called bronchoscopy. Asthma and allergy, chronic obstructive pulmonary disease, bronchiectasis, all kinds of chest infections, all kinds of interstitial lung diseases, and many, many more we can diagnose and treat in the Muscat Private Hospital. So, in case you have any of these problems, you're most welcome. We shall be there to help you and to diagnose and treat you the best possible way. Thank you.
I am Dr. Farid Zaidan, internist and nephrologist in Muscat Private Hospital. I have long experience of kidney and internal medicine disease, more than 35 years. And I was as head of department of internal medicine and nephrology of two of biggest hospital in Aleppo in Syria, and also as a head of renal unit and transplantation and hemodialysis for more than 10 years. Now, our work here to cover all disease of kidney disease and hypertension and all complication and disease related to this field. In Muscat Private Hospital, we have all facilities and all specialists and consultants can cooperate with us together to give more advanced and more accurate management for all kidney disease. I want to talk about one of very important thing now, diabetic nephropathy. That is mean because there is increasing of incidence of diabetes mellitus in Gulf country, and also as of course as Oman, one of that is Gulf country, the complication of diabetes mellitus also increasing, and one of the most important complication, diabetic nephropathy, that is mean disease influence on the kidney and in the work of the kidney, causes lot of complication. My opinion now, and not my opinion also, my old study, if the patient continue to follow up with a good consultant of nephrology, can prevent or delay that is complication of diabetes mellitus on the kidney. And we can do all the things here in Muscat Private Hospital for like that patient. Of course, not for diabetes nephropathy, but for all problem related to kidney disease and internal medicine. Of course, we have a team. All that team can work together to give more important, more accurate, more optimal management for the patient. My clinic work from morning to evening every day, 5 days per week, and we can give optimal management for all patients of diabetes and kidney disease, and we can arrange for future for hemodialysis, and now we arrange for future for hemodialysis, and also prepare the patient to do transplantation and all things related to this field. Thank you very much for all.
Assalamu alaikum. I am Dr. Farouk Radfar, Senior Consultant, Gynae Ops, working in Muscat Private since 2005. I have about 22 years of experience in Gynae and Ops management of the difficult cases, and we here deal with patients of antenatal, and we screen them for any abnormalities, any problems, and we see that they will follow through their pregnancy in the best way possible. And the gynae cases, which are of various types, are also managed and screened and treated here. We have screening of the cancer of the cervix and uterus, and management of the cancer of breast, and also we manage cases of the infertility, and we do several types of surgeries here, like laparoscopic surgeries, which you are more familiar with by the name Mandar. At Muscat Private Hospital, we try to serve you to the best of our ability and to see you to reach safety to your destination of health and happiness. And we use all the technologies and the state-of-art facilities which are in this hospital to give you the best services. Thank you.
Hello, I'm Dr. Kanchana Rajan, Senior Consultant in Obstetrics and Gynecology, and also I'm the head of the Department of OB-GYN in Muscat Private Hospital. Having had about 30 years of experience, we can manage all complicated cases in our hospital. I have been trained in India and also in UK, and then I worked in the government hospital in Oman for 20 years, and I managed all complicated cases both in obstetrics and gynecology. In Muscat Private Hospital, we have been managing a wide variety of patients, both in obstetrics and also in gynecology. In obstetrics, we take care of all the low risk and the high risk pregnant women and follow them throughout pregnancy and give care during pregnancy and delivery, and also in the postnatal period. We support them with the lactation advice. In gynecology, we've been doing minimally invasive procedures for many patients, and also outpatient colposcopy and gynae cosmetic surgeries like laser vaginal tightenings. Whether the patient is planning for pregnancy or she is in the first or second trimester or in the third trimester, we take care of the women throughout their pregnancy and counsel them according to their nutrition, and also screen them for diabetes in pregnancy, and also we do ultrasound scans to look for the Down syndrome screening, anomalies, and also growth of the fetus during pregnancy. In labor, we have dedicated midwives and also the doctors who conduct the deliveries for all women. We also conduct complicated cesarean sections for twin pregnancies and more than 2 or 3 cesarean sections, and also major degree placenta previa. We have conducted water births in Muscat Private Hospital, and also I have done maternally assisted cesarean sections for many women who requested it. If you have any concerns about any gynecological or obstetric problems, please do visit us at the Women's Health Department, and we would be more than happy to answer and clear all your questions. Thank you very much.
Hello, I'm Dr. Masoud Al-Riyami. I'm a senior consultant, sports orthopedic surgery. I'm working here in Muscat Private Hospital. I had my basic medical training in Western country, and my line of interest mainly is sports injuries. I do shoulder arthroscopies and related surgeries, like rotator cuff tear, labrum tear. I do as well knee with sports injuries, surgeries related to sports injuries like ligamentum reconstructions and arthroscopy work, as well as for the ankle as well. Sports injuries is something we get a lot of patients with sports injuries, and our surgery has very high successful rate, and after a period of rehabilitation, most of the patients they are able to go back to their loving sports. Myself, I am a FIFA advisor for sports medicine. I have been a member in the FIFA Committee of Sports Medicine for about 10 years. And until now, I do consultation for the medical committee of the FIFA, and I'm participating in World Cup and FIFA tournament as well. If you have further queries about orthopedic and sports medicine, you are most welcome to contact our hospital, and we'll be there to serve you. Thank you.
Welcome to Muscat Private Hospital. My name is Dr. Najib Arawahi. I'm a senior consultant cardiologist and adult invasive electrophysiologist. I'm working at Muscat Private Hospital since 2009. We established an arrhythmia management center, which is mainly concerned of patients with rhythm disorders. Rhythm disorders like patient feeling palpitations, some shortness of breath, and even some patients have syncope. Our experience is, my experience is almost 20 years in this field, and I'm a graduate of Sultan Qaboos University and trained in Canada with a fellowship in with the Fellowship of Royal College of Physicians and Surgeons of Canada. The main type of patient we see is a patient complaining of palpitations, syncope, and also a patient having heart failure, for which they may need implantation of special type of devices to improve their heart performance. Our big percentage of patients with heart failures, for which they have a weak heart, and many of them actually they will require implantation of special devices. It's like a pacemaker, but a more sophisticated type of device, and that most of our patients actually they improve their symptoms and they lead a better life after the implantation of the device. We are going to also start electrophysiological studies for patients with tachyarrhythmias, and this will increase our patient satisfaction and make us better equipped to treat our patients in various types of arrhythmia disorders. Thank you very much.
Hello everybody and welcome to Muscat Private Hospital. I am Dr. Omar Mohammed Shanas. I am emergency specialist. I have the Arab Board of Emergency Medicine fully trained, and I joined the program of Arab Board of Emergency Medicine on 2008, and I graduated as a specialist on 2014. And I joined this lovely hospital on 2015 to run our services for our patients, lovely patients in the emergency department here. Me and my colleagues are fully trained and we are ready to accept and receive the wide spectrum of emergency cases and conditions, including medical, surgical, gynecological and pediatric of course. And if you want to feel like you or one of your family member to be in the safe hands and to feel empathic on time you stressed, please come to our department and you will receive the highly standard and good medical service. Our objective to give good reputation and to feel our patient to feel good in our hands, and of course safety first. And we also give a wide spectrum of emergency services, procedures, and also first aid for trauma cases, and resuscitation also in case of any cardiac or pulmonary emergency happen to any patient. And we have also a full backup of all specialties behind us to support us on time and to dispose the patient properly and safely on the right position. And from my heart I say welcome to everybody to visit us, and they will feel very safe in our hands. Thank you very much.
I am Dr. Ramanathan. I am a senior consultant in orthopedics and sports medicine. I mainly deal with sports injuries, and I have been working in Oman for over 30 years and in Muscat Private Hospital since the year 2001, so nearly about 18 years. Now, sports is very popular worldwide, and Oman is no exception to it. Many reasons for sports being popular, but I suppose the most common one is that everybody wants to get fitter now and they indulge in sports. But what is the flip side to that? Sports injuries. And unfortunately, everything is good about sports, but when you get a sports injury, it can put you back many years. In Oman, the most popular sport is football. In the sports injury clinic that I set up in Kaula Hospital in 1989, nearly 90 to 95% of the patients attending were injured playing football. And in that, again, about 90% it was the knee joint that is injured. So you can say we are a very specialized sports injury unit in Muscat Private Hospital. And because of the type of sport that is played here, football, and the injury that occurs to the knee, we are specialists in all types of knee surgery for sports injuries. The most common knee injury is meniscal injury, which is the shock absorbers inside the knee, and the cruciate ligament, and of that it's the anterior cruciate ligament. In fact, this is the most notorious ligament, and unfortunately, many of our boys here suffer from this. Now, it is not the end of the world if you have a cruciate ligament injury. Fortunately, good surgery is available, and we have been doing the surgery since 1990, and many of our patients go back to playing the same level of sports that they played. So I think in Muscat Private Hospital, we offer a one-stop place for all types of sports injuries, especially knee injuries like meniscal and anterior cruciate ligament injuries. And we hope to continue this for many more years to come. Thank you.
Hello, my name is Dr. Rasha Abdul Hassan Al Hassani. I'm a specialist obstetrics and gynecology working in Muscat Private Hospital. I have about 20 years experience in obstetrics, and I have been working in Muscat Private Hospital since more than 5 years. In Muscat Private Hospital, we are dealing with almost all cases in obstetrics and gynecology. Regarding obstetrics, we are dealing with the low risk plus high risk pregnancies like gestational diabetes, preeclampsia, patient with multiple surgeries, even all complicated pregnancies. And in gynecology, we are almost dealing with most of the gynecological surgeries, laparoscopic surgeries. All these are done in our hospital. So if you are a pregnant lady, or if you have any gynecological issue, or you need any cosmetics in gynecology, you are most welcome in our outpatient clinic, and we will be more than happy to help you and serve you in a good way. Thank you.
Hello, good morning everybody. I'm Dr. Raymond Elias. I'm a general and laparoscopic surgeon at Muscat Private Hospital. At the same time, I'm the head of the Department of General and Laparoscopic Surgery and the medical director for the last 3 years. We are doing all types of surgeries at our facility, from the minor basic surgeries to the most advanced open and laparoscopic surgeries, reaching upper reflex surgeries and bariatric surgeries as well. One of the main interests in my field is the laparoscopic hernia repair, which I'll be talking about today. You know, you might have a bulge in your abdominal wall or in your groin, and one of your general practitioners will tell you that you are having a hernia. So better to consult a surgeon. We are here to welcome you and to discuss with you the possible treatment of your case, and we will offer you the best modalities of surgical repair of hernias. We are doing the most advanced laparoscopic hernia repairs, including all types of body hernias with the state-of-the-art equipment and the latest instruments. So I'll tell you, you are most welcome if you feel that you need a surgical consultation and to have a safe surgery, safe, compassionate practice, quick recovery, and better follow-up. You are more than welcome to come to Muscat Private Hospital, and we'll be here to help you. Thank you.
Hello, I'm Dr. Saeed, a senior pediatric specialist in Muscat Private Hospital, as well as neonatologist. I did my graduation from Rawalpindi Medical College, Punjab, Pakistan, and my post-graduation was achieved in UK. I did my diploma in child health from Glasgow, and membership from Royal College of Pediatrics and Child Health, London. I had been working in this hospital for last 10 years, and this hospital pediatric department is really a fantastic department. It comprises all subspecialties which one needs for the care of a child, a sick child, I would say. It includes pediatric neonatology, pediatric pulmonologist, pediatric neurologist, pediatric gastroenterologist, endocrinologist, pediatric surgeon. We do run pediatric outpatient department 6 days a week from 8 a.m. up to 9 p.m. and during this time we have a busy unit comprising all age of children from day 1 up to the age of 14 and having various ailments involving respiratory system, cardiovascular system, gastroenterology. Muscat Private Hospital is a unique hospital in Muscat region in the sense that, as I mentioned, it contains and comprises all subspecialties in the field of pediatrics, and it is well-developed, well-built, state-of-the-art hospital which has a fully developed neonatal intensive care unit where babies, newborn babies with all sort of ailments related to newborn or even postnatal period, they are managed and taken care very well by experienced pediatricians, I would say neonatologists and dedicated nurses. In Muscat Private Hospital, inside wards also we have trained specialist registrars and who are quite well versed with the management and solving the problem of children right from day 1 up to 14 years of age. So in that way, our lab, our X-ray department, that is radiology department, as well as other facilities like EEG, like sleep studies, and so many other things which other subspecialties they need, we do have all these facilities under one roof, and we do carry out in a very standard, ethical, professional, and elegant way. So my message to everyone is those who feel that their child needs a very well organized, a devoted, a dedicated care. The Muscat Private Hospital is the prime place where they can come and they will be reassured and they will be given full support, care, cover, love, and whatever a child needs. Thank you very much.
Good morning, I'm Dr. Sanjeev Gupta, Senior Interventional Cardiologist working at Muscat Private Hospital. Muscat Private Hospital is a very renowned hospital which has been working, oldest hospital in the private sector, and I've recently joined it. I myself am an interventional cardiologist working for the last 25 years with experience both in the coronary and the structural field. My training has taken place in France, where I've got trained in coronary interventions and structural procedures like TAVR, LA appendage closure, PFO closure and mitral clip. At MPH, the cardiac division consists of non-invasive and invasive facilities. The non-invasive facilities include echo, treadmill, dobutamine stress echocardiography, BP monitoring, while the invasive department consists of a dedicated cath lab where we practice interventional procedures, coronary angiographies, coronary angioplasties, electrophysiological procedures like pacemaker implantation, pediatric procedures, and even peripheral interventions. We are the only hospital in Muscat which gives 24 by 24 hour services, chest pain services, and we regularly do primary and rescue angioplasties for our patients. The hospital is in the process of upgrading its services, and we wish to introduce structural procedures like transaortic valve replacement, PFO closures, LA appendage closures, and as this upgradement takes place, we will be offering these services to our patients on a regular basis. The team of cardiology consists of 2 consultants, 1 specialist, plus ancillary staff for supporting us on a regular basis. We are grateful to the entire team of Muscat Private Hospital, the ER department, the anesthetic team, and other departments which provide support to us and help us in doing our services and providing care to our patients in a smooth and efficient manner. Thank you very much.
Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Hello, I'm Dr. Sania Taib. I'm a senior consultant in obstetrics and gynecology. I recently joined Muscat Private Hospital to join the expert team to manage all sorts of gynae and obstetric cases. I have special interest in managing high-risk pregnancies as well as performing cosmetic gynecological operations. I also manage all sorts of different types of infertility problems. We'd like to see you here in Muscat Private Hospital so we can help you in overcoming all your medical problems, and we'd like you to come and enjoy the friendly atmosphere and the environment here. Thank you very much. We hope to see you soon.
Assalamu alaikum. I'm Professor Dr. Tahir Lawati. I'm the head of breast surgical oncology, oncoplastic surgery unit in Royal Hospital. I'm also senior consultant visiting at Muscat Private Hospital. I'm adjunct professor at University of Polinis in Greece, and I am the executive president of European Association Society of Surgical Oncology. I have established the first breast oncoplastic clinic at the Royal Hospital, and the same clinic I have established in Muscat Private Hospital. Now, what type of surgeries we are doing? We are doing all types of surgery at Muscat Private Hospital, from diagnostic procedures to reconstructive surgeries. Patients with us, they are having a fight against cancer. We can get rid of cancer, but at the same time, women with breast cancer with us, they don't lose their breasts. They maintain their breasts because of the advanced technique we are adopting of breast reconstruction, immediate reconstruction, which are the same used in Western Europe and North America, as they are based on the same advanced protocols of surgery in all North America and Europe. We are here proud in Muscat Private Hospital to say that we are the first to do what is known lately as Angelina Jolie effect, where she had to remove both breasts and reconstruct from abdominal fat, from stomach fat. That was done for Angelina Jolie a few years back, 2 years back. We have done it in Muscat Private in 2004. And that was the first achievement of reconstruction in Oman for an English lady who came all the way from UK to get it done by me here in Muscat Private. This is one of the achievements, but it is not the only one. We are doing reconstruction, we are doing breast surgery with immediate reconstruction. All our patients get reconstructed immediately. Either they've done benign or malignant surgeries, they get cosmetic surgeries at the same time of the lumpectomies or tumorectomies or wide local excision. So, in addition, we ask our patients to have screening, and we have a very good screening tools here and screening program here for breast cancer, and we have also a follow-up programs for patients with breast cancer or suspected breast cancer. So I advise you all to come and visit our clinic to have a checkup, and hopefully there is nothing wrong, as most of the ladies, they don't have anything wrong, but then if God forbidden there is anything, we can take care of you. Thank you very much.
Hello, I am Dr. Tariq Amin Sheikh. I am a senior consultant orthopedic surgeon in Muscat Private Hospital for the last 13 to 14 years. I was also the head of the unit in Khola Hospital for the last 30 years. I deal primarily here in Muscat Private Hospital, patients coming with various general orthopedic problems like knee issues, injuries, trauma, but my main specialty is pediatric orthopedics, which deals with the problems in children. We would like to mention here that there are so many disorders and diseases of the children which, when picked up very early, can prevent catastrophic problems in children. So it is mandatory for all the children who are born, and especially with the family history of any issues in the family or near relatives, should be seen at least once by the pediatric orthopedic surgeon. I am qualified and I have a fellowship from Dublin, as well as many fellowships from the other countries like UK, Austria, and also I was trained in United States of America for a special treatment in children with the clubfoot deformity. This is extremely important to understand, that the children who are born with the deformities, if they are brought just after the birth, we follow the same principle what has been followed in Iowa University in USA, and we are in direct communication, and we put the feedback to these universities with our results. These children, when they are treated in time, we can prevent the deformities in future, bone abnormalities, and they can be like normal children. In fact, they play normal football and all other activities. The other main issue is the dislocations of the hip, which is really a very important aspect. And in Oman, we have plenty of children because of the marriages happening in the families. So it is mandatory for the children to be careful and make sure that their child is being seen and screened for the dislocation of the hip, because the treatment is so simple when they are brought early with just a belt. So I would like to say that it is better to be on the safer side rather than repent afterwards. So if your child has the slightest problem, if you have any family history of any disorders, it is better to consult early so that we can give and treat your child appropriately with good and expected results. Thank you very much.
Bismillah ar-Rahman ar-Rahim, dear brothers and sisters. I would like to introduce myself to you. I am Dr. Tawfiq Muntaqi Lawati. I'm the senior consultant in pediatric gastroenterology and hepatology, as well as in child health and pediatric diseases. I would like to talk to you about abdominal pain in children. Abdominal pain is very common, as all the parents, if you are a parent, you know about that a lot. And abdominal pains start from children as young as a newborn and all the way to an adolescent, a 14 and 15 years old young chap. Now the reasons and the causes of abdominal pains are very variable. Causes of abdominal pain in a neonate, for example, might be just because he cannot tolerate his milk, or all the way to more serious and uncommon diseases, if you might, in slightly older children. Unfortunately, many people attribute abdominal pains in children, especially at the age of 4 years and 3 years, that perhaps in early school days, as this is an indulgence and he is making it up and he's a spoiled kid. Perhaps that's not the whole truth. The truth is that actually we can investigate all these children and we might actually find out a very silly reason for their abdominal pain. Maybe they just cannot tolerate milk, for example. Or maybe they have got something or simple or slightly more difficult which we can handle. And doctors, if you actually present to them with abdominal pain with your children, they've got a lot of investigations which might be as simple as just a stool test, if you like, or it might be doing blood tests and x-rays. Now we also have endoscopy in children, and unfortunately many people get scared and put off when you actually talk to them about endoscopy. I would like to assure you, endoscopy now has become very convenient, and there is a lot of expertise in pediatric or childhood endoscopy. So please don't be very reluctant if the doctor advises you to get an endoscopy for your child, because as I have said, there is an immense experience behind that. I would like you all, if you do have a child or a young adult who has got abdominal pain or diarrhea or any similar problem in his tummy, please don't hesitate to visit a doctor, because you can help this child. I wish you all and your children all the health and all the prosper, and I thank you for listening to me. Thank you very much.
Bismillahirrahmanirrahim. Assalamu alaikum. I'm Dr. Zainab Ali, Senior Specialist OB-GYN, Muscat Private Hospital. I'm in this beautiful Oman country since 2015 and working in the Muscat Private Hospital only. Muscat Private Hospital believes the wellness of the woman. Women are the integral part of the society. Healthy women means healthy population and healthy future generation. Women should be educated regarding normal and common health issues like nutrition, anemia, heart diseases, diabetes, high blood pressure, cervical screening program, and breast cancer diseases, vaginal infection, preconceptional counseling, management of pregnancy, pregnancy-related issues, and complications. Most common is the cervical cancer. Cervical cancer screening is one of the most common, affordable, and accessible. Cervical cancer is one of the most important and most common cancer in the women population. Approximately, if not treated, approximately it causes 90% of the death in the women population. Pap smear is one of the most common diagnostic and screening program to identify the abnormal cells in a transformation zone of the cervix where the dysplasia occurs. We at MPH, specialists in all the fields, screening, diagnosis, and treatment and management. Hope to see you soon in MPH Gynae department. Thank you.
Hello, my name is Dr. Zaid Sidai. I'm internist and pulmonologist. I work for Muscat Private Hospital for the last 3 years as specialist internal medicine. We in Muscat Private Hospital are proud to be the only private hospital in Oman that have the full subspecialty in internal medicine, beginning from neurology to nephrology and endocrinology and pulmonology. As a part of this hospital, I'm proud to tell you that we have full care of diabetic patient, beginning from retina to diabetic foot. In Muscat Private Hospital, we ensure to take care of you as much as possible, professionally and promptly. In Muscat Private Hospital, we have a full team working 24 hours in the emergency and in the ICU for full backup. We strive to ensure that you will promptly and professionally taken care of whenever you need us. Thank you.
Hello, this is Dr. Ahmed Jahori, Senior Consultant Orthopedic and Spine Surgeon at Muscat Private Hospital. We at Muscat Private Hospital see many patients with back problem. And as you know, spinal surgery is very common, field of medicine, with a lot of patients comes with symptoms of back pain, which is very common. Here at the hospital, we try to give a personalized and tailored spine care for each patient. That means we have different programs for every patient, depends on the disease and the pathology that this patient suffers from. For example, we have patients who have muscular back pain, disc herniation, lumbar degeneration, curvature changes and deformity of the spine like scoliosis. So we try to serve every patient with the best care ever that we can give in the field of spinal care. That will include non-operative treatment and operative treatment. The non-operative treatment includes pain management with different modalities, and also we have the physiotherapy and rehabilitation with laser therapy. There is also different spinal manipulation therapy and traction. And then we exhaust all those non-operative modalities. Then at the end we decide for spinal surgery, which involve again different modality of spine surgery, whether it's decompression, discectomy, laminotomy, or fusion of the spine. And that again depends on the pathology that the patients will have. We discuss the risk and benefits, and we really spend a lot of time to counsel the patient about what will be the outcome result of the surgery and what would be the after surgery care, which is again another program given to the patient here in the hospital, including the pain management, rehabilitation again after the spine surgery, and also includes return to the daily function, and we try to return the patient to the activity and to work as soon as we can. Thank you.
Hello, my name is Dr. Mohammed Rida Al-Lawati. I'm consultant in internal and respiratory medicine in Muscat Private Hospital. My training in internal and respiratory medicine was in United Kingdom and Australia. Following that, I worked in Royal Hospital, Al Nahda Hospital, and also in the Ministry of Health. Our clinic in internal medicine looks after many patients, but including the patients of hypertension, diabetes mellitus, high cholesterol. Today, in this age group, these diseases are called the lifestyle diseases. And so here we do not just treat the patient, but also we address the issues of lifestyle. And so we discuss the patients about their eating habits, about their exercise habits, and advise them on the same. At the same time, being a pulmonologist and a specialist in respiratory medicine, I also take care of patients with bronchial asthma, pneumonia, and tuberculosis. And so here in internal medicine clinic, we have a good range of doctors who provide service to all kinds of diseases. Feel free to come to us to seek advice on any of these diseases and for the follow-up. Thank you.